Good evening and welcome to Chicago Tonight. I'm Paris Schutz. Brandis Friedman has the evening off. On the show tonight,
none of us think any of this legislation is perfect.
More stimulus checks will be coming to most Americans after Congress passes a $900 billion coronavirus relief package. But critics, including President Trump within the last hour, say it's not enough.
They can be assured that we will respond.
President-elect Joe Biden vows to punish Russia for the massive cyber hack of U.S. agencies. We hear from members of Congress on this and passing that COVID relief package.
The finish line is in sight, and we can't afford to stop running.
The coronavirus pandemic has been a marathon. The U.S. Surgeon General comes to Chicago to urge everyone to stay the course. We've got the latest on the coronavirus vaccine. A Chicago-based foundation wants to change the way adult long-term care facilities are ranked nationwide.
I thought we weren't going to get school pictures.
It's a COVID picture day. A local couple recreates the school tradition for some students who didn't have one because of remote learning. And the Chicago Symphony Orchestra has a musical gift for you this holiday season, a virtual recital with pianist Jorge Federico Osorio. But first, some of today's top stories. Police Superintendent David Brown says he will tighten the department's rules for search warrants. This comes during a contentious 6-hour joint city council committee hearing about a botched raid that left a Chicago woman handcuffed naked. Among changes, Brown says the department will ban no-knock warrants except in situations in which someone's life is at risk, and a warrant can no longer rely on information provided by an informant paid by the department for information. Brown also promises to begin tracking data about search warrants.
CPD is resolute that we must change our culture. It is always the right time to do the right thing. Everyone deserves a measure of respect and basic human decency. And again, we must be first to admit our mistakes.
And just before the hearing, Mayor Lori Lightfoot announced retired Judge Ann Claire Williams will lead an outside investigation into the raid and the way the mayor's office, the city's law department, and the police department handled it. In the letter to Alderman, Lightfoot wrote, quote, "We must get to the bottom of what transpired around the wrong raid of Miss Young's home and all that followed." Chicago Public Schools expects to see $800 million in funding from the federal stimulus bill passed last night, according to the district. Per federal law, CPS must allocate $80 million of that to go to non-public schools. In a release, CPS CEO Janice Jackson says the funds will be used to support the critical resources needed to reopen classrooms, expand access to high-quality academic programming, employ record-high numbers of nurses and social workers, invest in social and emotional supports, and provide additional resources to our highest-need schools. For additional details on the funding, you can visit our website at WTTW.com/news. Illinois health officials report more than 6,200 new cases of the coronavirus. There are also 116 additional deaths in the state reported today. That brings the total number of cases in Illinois to more than 911,000 and the state's death toll to 15,414. R&B singer R. Kelly has a new trial date in his sex abuse case. After months of delays due to concerns about the coronavirus, a federal judge set Kelly's trial for September 13th. The date is tentative given uncertainty surrounding the pandemic. Kelly is charged in Chicago with child pornography and obstruction of justice. He's also facing charges in Minnesota and New York, all related to allegations of sexual abuse of children. He is currently being held at the Metropolitan Correctional Facility in Chicago. Congress finally passed a $900 billion stimulus bill in the House. It was a 359-53 vote. Here's what House Speaker Nancy Pelosi had to say.
So we consider this a first step, and that, again, more needs to be done. We're so excited that that will be happening under the Biden-Harris administration.
Here to talk about passing the stimulus and lots more are Congressman Brad Schneider, a Democrat representing Illinois' 10th District, which covers a portion of Chicago's northern suburbs. Congresswoman Jan Schakowsky, a Democrat representing Illinois' 9th District, that includes parts of Chicago's north side and northern suburbs, and Congressman Rodney Davis, a Republican who represents Illinois' 13th District, which includes Springfield and winds south and west toward St. Louis. Welcome all of you back to Chicago tonight. Congresswoman Schakowsky, $900 billion, $600 one-time payments to most individuals, $300 supplemental unemployment relief. Are you pleased with the final product here, or is it too little too late?
Well, it certainly doesn't alleviate all the pain that people are feeling and expressing to their members of Congress, but it certainly is a help. The $600 payment, it can go for a family of 4, would come to a $2,400 payment, which certainly helps. And I call it, rather than a stimulus payment, a survivor payment, because this is just needed for people to hold on. So I think as Nancy Pelosi has said, it's a beginning, but it's certainly, we need to do more to help small businesses, to help state and local government, and to help the unemployed. Although they got some help this time, but we need to do more.
Congressman Davis, looking at this bill, dissecting it, according to the Joint Committee on Taxation, there's $100 billion in tax breaks for special interests like liquor producers, electric motorcycles. Are these more necessary than higher payments to individuals?
Well, when it comes to putting a big piece of legislation together, there are going to be people that have provisions they want put in place. One tax provision that you may not have mentioned is one that I champion. It's to allow employers to be incentivized to help pay down student debt of their employees. A voluntary private sector approach to dealing with the next fiscal crisis once we get through the pandemic, and that's the ever-burdening student loan debt crisis. But in the end, I think history is going to judge us pretty well coming together again to help our mom and pop shops, give them access to PPP loans again, because we're in the midst of Governor Pritzker's executive orders who have told many businesses that they can't operate. They needed our help, and we did it.
And to that effect, Congressman SCHNEIDER, Governor Pritzker has asked for federal relief. The mayor has asked for federal relief. That $160 billion package for state and municipal governments is kind of sitting off to the side. Why has that not gained traction?
I know that our local governments are really struggling. They are struggling providing the essential services, police, firefighters. They're covering extra costs from PPE. So, you know, I'm a member of the Problem Solvers Caucus that came together and made the initial proposal, the $900 billion proposal that became the framework for this package. And part of that was $160 billion for our state and local governments. There just wasn't enough support to get that across the finish line. It became a stalling point, but as Jan Schakowsky said, this is a down payment. This is not the final piece. And as Rodney Davis indicated, I think history will judge us not just how we did this time. It is good that we came together, that we found a bipartisan compromise, but this can't be the end. Hopefully it's a path forward that over the next months, as we move the vaccine out, we will provide the relief we need, and then ultimately for a recovery and renewal of the American economy to get people back to work.
Congressman,
well, I can say one great thing for Chicago. The payment checks, the survivor checks that are going to come are also available to mixed status families. In other words, right. The last time, if even one person was not documented, that check would not go to that household. We changed that, and so that families that have someone who is not documented can also get the payments. It's really good.
We should also mention there's hundreds of millions of dollars for CPS and other education systems in here, as well as transit systems. Congressman Davis, you heard your colleagues saying this is a down payment. Do you think in the next Congress there'll be appetite for another round of stimulus?
Well, we'll have to see how this addresses the problems that we see in our communities and in our economy right now. You know, it's where we fundamentally disagree as Republicans and Democrats. You know, my colleagues, we worked well together on this, but their philosophy is to talk about what is the next step. How can we spend more? I think we need to take a step back, decide what's being utilized, what still exists from our previous CARES Act funding, and we make the best, most fiscally responsible decision. But the good news is we addressed a lot of problems that our constituents have come up to us together to ask us to address. And I'm excited for that.
All right, let's shift gears to a major national security issue. President-elect Joe Biden addressed the massive cybersecurity breach widely attributed to the Russians today. Take a look.
When I learn the extent of the damage, and in fact who is formally responsible, they can be assured that we will respond, and probably respond in kind. There's many options which I will not discuss now.
Congressman Schneider, this is widely attributed now by Trump's own cabinet officials to Russian intelligence services. It's penetrated the highest levels of government agencies like the Treasury Department. What more do you know about it?
Well, so what we have heard is that it penetrated not just government, but American companies as well. We don't know the full extent, but we know that it is we've never seen anything like this, and it is not just a fishing expedition. This has put our infrastructure at risk, our critical infrastructure, like our electrical grid, our industry. They were trying to get information about vaccines. So we don't know the extent or the direction that this might take, but as President-elect Biden has said, whoever's responsible, and all arrows are pointing towards Russia, has to pay a steep price for this. I'm disappointed the president has refused to condemn Russia or Vladimir Putin for putting bounties on the head of American troops. He hasn't said anything about the attempted assassination of Putin's rival, Navalny. And once again, he is denying the severity or the provenance of this hack, while his cabinet officials, Secretary of State Pompeo, Attorney General Barr, have said this clearly looks like it's coming from Russia. We need to make sure whoever did this pays a steep price.
What about that, Congressman Davis? Does the country need to hear more from President Trump about this? He, in a tweet, downplayed that Russia had anything to do with it.
Well, first off, the Russia bounty story, that's been debunked. I mean, that's the problem we have with today's society, that we have unnamed sources that come out and talk about what's happening in
I don't think that story's been, Congressman, with respect, I don't think that story's been debunked, but let's talk about this issue.
The Russian bounty story has been, Paris, and that's one that I'll continue to chat about, and we can talk about that at a future time. But in the end, there's not been a president that's more communicative. Unfortunately, it's been through 120 characters or less on Twitter. And I certainly hope that all government officials will tweet less and govern more.
Congresswoman SCHAKOWSKY, colleague in the Senate, Senator Durbin, called it an act of war. How serious is this?
Well, you know, when the President of the United States says, well, it could be China, it could be, but at the same time, we know now, everyone seems to agree that it is Russia, and the Defense Department, the State Department, all of these agencies of government have now been invaded by the Russians, and this has gone on for months and months. The president refuses to acknowledge that. It's just incredible in face of all of the evidence, of all of the things, as the other congressmen have mentioned. He has refused to blame Russia for anything, including going after our troops in Afghanistan.
All right, we're going to have to leave our discussion here, but we'll be back in a sec. Our thanks to Representative Schneider, SCHAKOWSKY, and Davis. As we said, we'll have more with them later in the program. Thank you so much. And now to Phil Ponce and more on the state of the economy. Phil.
Thank you, Paris. And as you were just discussing late last night, Congress passed a $900 billion COVID-19 relief package. It includes direct stimulus checks to many Americans, probably most, extended unemployment relief, and billions for small businesses. Joining us on whether this latest package is enough or if it's too much are Benjamin Jones, economics professor at Northwestern University's Kellogg School of Management. Jones was a senior economist for the White House Council of Economic Advisors during the Obama administration, and Rachel GRESZLER, a research fellow in economics, budget, and entitlements at the Heritage Foundation. That's a conservative-leaning think tank based in Washington, D.C. And thank you both so much for joining us. And before we get to the discussion, let's take a quick review of what that stimulus package entails, a little more detail that we've been hearing. It will include $600 in stimulus checks for people earning less than $75,000, $300 in weekly unemployment insurance payments, $284 billion in small business loans, $25 billion in rental assistance, and an eviction moratorium which is extended until January 31st. Let's begin with Benjamin Jones. Benjamin Jones, how effective do you see this package as being?
It's a very big package. I think it'll be effective both as stimulus for the economy as a whole, and perhaps much more importantly, it has an enormous amount of social insurance in it to help those who are out of work and are particularly suffering during this economic crisis.
Rachel GRESZLER, how effective do you think this package might be?
Well, I think that at the price tag here of $900 billion, and we're talking about adding another $7,500 in debt per household in America, this is a lot bigger package than we needed. It would be nice to see something that was smaller and more targeted. I think that that could do a lot more good, focusing on the health side, the vaccine deployment, rapid at-home testing. You know, I think there's a lot in here that's not actually going to stimulate the economy and be effective, because these blanket policies, now that we're 9 months into the crisis, are not what we need, but kind of more targeted ones to the people who are still in need.
And there have been mixed reactions to this bill. Here's how one Republican senator described it.
The next time you see Republicans in high moral dudgeon claiming and complaining about spending of Democrats and socialism, remind them if they supported this monstrous bill that really the difference between the parties is less Adam Smith versus Marx and more Marx versus ENGELS.
Benjamin Jones, we heard some congressmen, Democratic congressmen, telling Paris just a bit ago that this was just step one. Is more going to be needed, do you think?
More might become needed in the sense that much of the programming here in this bill may sunset in March. And it's quite possible that, you know, vaccines have not been widely distributed at that point, and we're still in a severe downturn. So in that sense, with regard to the timing, I think maybe more would be needed in programming. The actual size of this program is vast, and in some sense, I would agree that sort of there's more than is needed over the next few months in this bill.
Rachel GRESZLER, one hope is that this will be enough to keep the economy going until the economy returns to normal with vaccinations taking place and so forth. Is that how you see this, as a possible bridge to get the country back to where it can organically come back?
Well, you know, I think where we come back to is not going to be where we started. There have been some permanent changes in the economy, but we've already seen a really strong recovery so far. It's pretty close to a V shape. You know, in the third quarter, the GDP was less than 100 billion below what it was last year. And so we're really on the pathway to significant improvement. I actually worry a little bit more about some of the provisions, like the structure of the unemployment insurance benefits that are a flat benefit and that don't depend on what people were making before, is potentially leading to higher unemployment in the future. And that's what the CBO and some Federal Reserve studies and others have indicated, that when you have those prolonged benefits at a higher level, you might lead to higher unemployment, lower output in the long run. So I worry a little more about what this might do to pull back on that.
Benjamin Jones, how about that? One criticism of the $600 that people were getting in unemployment benefits was that it actually was an incentive for people not to go back to work. Is that a real problem, do you think?
I think conceptually that sounds very logical. I think the empirical evidence is much more in the other direction. It suggests that higher wages at the low end don't necessarily dissuade entry into employment, nor does sort of an income floor dissuade people from wanting to work and make their income and lives even better. So I see this as more about kind of getting the economy roaring to go as the vaccines come into play, and so that we come out of the gates with a lot of demand in the economy, and so people really go out and spend and get us back to full employment quickly.
Rachel GRESZLER, some people are arguing that perhaps it should have been a little more targeted, that $600 for people who are earning over $75,000 will still get some relief. Should there have been a greater amount for people making under $75,000?
Well, I don't think that we should be targeting sending money to people who still have their jobs, and that's the case for 93% of Americans. And while it might still be helpful, who doesn't want to receive a check? We saw from the last stimulus payments, when people were more in need, that they actually mostly contributed to higher savings rates and people paying off their credit card debts. Americans saved $1.2 trillion more in 2020, just between April and October, than they did in 2019. And they also reduced their household credit card debt by 11%. And so that's a great thing, and it makes Americans better prepared for any future crises that might come. But it's not a reason that we should send more checks out there, because that indicates that people probably won't go out and spend the money yet until, society is more open and there are more avenues for people to spend their money. They're not going to go out and do that, and it's not going to be stimulative. It's just going to add to the debt.
Rachel GRESZLER, let me stay with you for a second. With the vaccines not being distributed, what are your expectations as to when the economy might sort of come back to a semblance of normalcy?
Mm-hmm. Well, it's still going to be months, certainly. And, I've got kids at school. I don't know if they're going to go back to school until the fall of 2021. And that's a big impact on society when children aren't going to school. So I think it's still going to take a while, but there are some underutilized resources out there. Like there are these $5 rapid at-home tests. You can have results in 15 minutes. But those haven't been given approval yet for individuals to do them at home. They have to send them off to a government lab. If that approval was given and we could have up to half of the population testing themselves every 4 days at a cost of roughly $15 billion, that would go a long way towards people being able to safely go back to resume most of their normal activities.
Benjamin Jones, in 5 seconds, when do you think the economy might be back to some semblance of normalcy?
The economic solution is the vaccine. We can't get it out there fast enough. I want to see a lot more effort from the federal government on exactly that dimension. It could be a few months. If we wait till the summer, it's a huge challenge for our economy and, of course, for our health.
And that's where we'll have to leave it. Benjamin Jones, Rachel GRESZLER, thank you both for joining us. We appreciate it. And now, Paris, back to you.
Thanks, Phil. There's no place like home for the holidays, like literally in your own home with only the people who normally live in it. A trio of high-profile medical officials made that plea to Illinoisans today amid spiking COVID cases and the fast-approaching Christmas holiday. Amanda Vinicky joins us now with more. Amanda.
Yeah, Paris, that tag team of physicians, Illinois' Dr. NGOZI EZIKE, Chicago's Dr. ALLISON ARWADY, and somebody who's less familiar, at least on the stage, and that is U.S. Surgeon General Jerome Adams. Their morning included a visit to St. Anthony's Hospital on Chicago's west side.
We got to see people get vaccinated. Luis, a nurse in the ICU, which, by the way, is at capacity, had just gotten his vaccine. And one of the things that I want everyone to know is that it's important that we take COVID seriously.
Especially now, Dr. Arwady says Chicago did see a bump in coronavirus cases after Thanksgiving.
Today is the first day that we are back down in both our cases and our positivity below where we were at Thanksgiving, and it's still not good. Here in Chicago, we're adding an average of 1,276 cases per day. That's more than 3 times the top level of what we need to be.
So avoid the hustle and bustle. Arwady says for Christmas, spread joy, not COVID. The message comes as there's fear about a coronavirus variant detected in England, believed to be even more contagious. The Surgeon General says the federal government is considering working with airlines to encourage people to be tested before they fly. But he says at this point, there is no need to ban flights from the UK.
Viruses mutate all the time. That's what they do. The SARS-CoV-2 virus that causes COVID-19 has mutated over 20 times so far this year. That doesn't mean that it won't work, that a vaccine won't work. It doesn't mean that it is more dangerous. What it means is that we will continue to look at this and to follow this virus, working with the WHO, the CDC.
Even if it does get to the point that it's mutated so much the vaccine does need to be adjusted, Adams says science can handle it. He says that's what happens every year with the flu vaccine. Adams last week got the COVID vaccine along Vice President Mike Pence. He says he did it in part to help reassure people of color who he says understandably may have reservations about it. The Trump appointee also went out of his way to emphasize getting the vaccine is free, and it's for everyone.
Dr. EZIKE and Dr. ARWADY confirmed to me that no one will be asked for an identification when they come in to get vaccinated, and that no one will be denied a vaccination because of their documentation status. They won't even ask you about your documentation status. So important for people to not be fearful of coming in to get vaccinated.
Today in Chicago, Adams downplayed the confusion over shipments of the Pfizer vaccine, saying that hiccups along the way are understandable. He also says those concerns are bearing the lead, with the Moderna vaccine now also approved for emergency use. Millions more doses will soon be on the way. He's hopeful that half of the U.S. adult population will be vaccinated by the end of February. That's around when Chicago is hoping to be through with the first phase of vaccination, focused initially here on healthcare workers. ARWADY says there's no specific hard timeline. She says now we're in the Beanie Baby phase.
Everybody wants it and there's not quite enough. But as more and more vaccine becomes available, we will start to see some shift there. And as soon as we're at a point where we're not using really all of that vaccine to vaccinate healthcare workers, that'll be approximately when we're ready to move into phase 1B.
Phase 1B, that's when those over 75 years old and frontline essential workers, so think grocery store clerks, will be able to get their shots in Chicago. For now, though, both the city and the state are looking to next week, Monday, for the first vaccines to be given in long-term care facilities and nursing homes. There's no word yet on which of those long-term care facilities will be first in line, though. Meanwhile, Illinois' Dr. EZIKE says another virus, the flu, is down.
We have seen very low levels here in Illinois. And also, let's remember that the same measures we're using to help prevent the transmission of COVID is hopefully going to really keep the flu numbers down for this season.
Then again, the flu doesn't typically spike until January or February. So if you're wanting to get the coronavirus vaccine and you can't just yet, well, it is not too late to get your flu shot. Ferris, back to you.
All right, Amanda. And up next, recreating School Picture Day, so please stick around.
Latinos, who make up 1/3 of the population, continue to power the city that works.
These are the people that are working 3 jobs, knowing that COVID is out there. Those are the people that need the help, and we should help them.
Whether you loved or hated it, it was something everybody had to do growing up. School Picture Day, but that isn't the case for some Chicago area students who've had to switch to remote learning since last spring. So to help out some friends and their kids, one local couple took it upon themselves to recreate the tradition. Here's Brandis Friedman with a look at their COVID Picture Day.
Where is she gone? I like that.
Earlier in his career, Chicago photographer Jeff Dahlgren says people were surprised he didn't have kids.
As a photographer in photographing lots of kids, you know, people always assumed that I had kids, and people would always ask, you know, I can't believe you don't have any kids.
But that changed when he and his wife Jen welcomed home their son Kender.
We adopted him from Haiti. The process took about 2.5 years. We had a home, and he needed a home. That's kind of the short story of it, really.
He's changed everything in our world, and you know, I can't say enough about that. It's pretty awesome.
The Dahlgrens have taken pictures over the years and cherished Kender's school photos. And like many families this year, they've had to adjust their son's education due to the pandemic. But being at home didn't mean they were going to skip tradition. A classic school picture for Kender and his friends.
I had the thought kind of in the fall, and I put it aside, and then you know, when it started coming around to Christmas, which is when I usually put, you know, Kender's school pictures in the Christmas cards to family, it kind of hit me again in a more strong, solid way. Like, we need to do something.
So, to make up for a lack of picture day at different schools, a COVID picture day was born at the Dahlgren studio, Throop Studio.
We had a sign greeting them in case I wasn't here, instructing them what to do so they wouldn't start wandering in looking for me. I did a temperature check of everybody that came in. Then they moved in and had their picture taken, and then they moved out and they went out the other door so nobody crossed any paths. We timed them out at 15-minute intervals. I kind of wiped things down in between just to make it safe. Jeff created an online gallery. Any parent can just go with the login and download and use and share.
But first, it's lights, camera, school picture. And Kinder's playlist.
Jen and Jeff live in the neighborhood. We walk to school together under normal circumstances, and they were nice enough to include us in this picture day. I think it's really meaningful to have their photos taken because we do it every year, and every year we do something special for the grandparents and the family, and to miss a year would have been really sad.
I know that she has a son who's around Jonah's age, that she was thinking about how we could get school photos, and I thought it was really interesting, especially since so much about this school experience is not traditional for kids. So if we can kind of create a picture day experience, I thought it was cool. So when I got the phone call, I was like, yes, you're doing it.
It's a nice nod to the tradition of having one every year in the same setup with the same way. You know, we have a little gallery of his school pictures every year from preschool, but those little traditions are, I think, what's been missed a lot of during this pandemic.
Jen Dahlgren says a big part of the tradition is the pose.
It doesn't feel like a class picture if it doesn't have that kind of forced and kind of a forced smile. Everybody has those pictures, and everybody has some good ones and some bad ones.
Everybody, including the parents.
All the bad hair.
Yeah, terrible crooked haircuts and, missing teeth, and maybe my teeth weren't brushed,
It's still an event somehow. It was for me, X number of years ago when I was having school pictures taken. It's the same for kids today.
The Dahlgrens say it's special because kids grow up too fast.
They go from just this little kid sitting there. Next thing you know, you're having like a negotiation about how, you're supposed to go put your jacket on and head out the door.
All right, eyes right back towards me.
I don't want to miss it. I feel like sometimes you look back in life and you wonder, why didn't I do this or do that? And it seems so small, but when you look back, it kind of, not that it was big, but it was significant in some way.
For Chicago Tonight, I'm Brandis Friedman.
And Jeff, Jen, and Kender say what they enjoyed most about Picture Day was seeing friends and family they haven't seen in months, some as long as since the beginning of the pandemic. And we thought we'd share school pictures for some familiar faces here at Chicago Tonight. Recognize these kids? That's me, either in preschool or first grade. I think first grade probably. And then that's Brandis in what she believes is preschool. Waiting for that bowl haircut style to come back. Still to come on Chicago Tonight, members of Congress share their thoughts on the continuing effort by the president and some of his advisors to overturn the election. A Chicago-based foundation is trying to change how adult long-term care facilities are ranked. Plus, pianist Jorge Federico Osorio on what it was like recording a recital in an empty orchestra hall. But first, some more of today's top stories. Employees of Cook County's healthcare and sheriff's departments hit the picket line today for a one-day strike. SEIU Local 73, that's the union representing Cook County workers, said in a statement on Friday that the county has, quote, refused to set bargaining dates, canceled bargaining dates, and walked out on negotiations for nearly 3 months. Among other demands, strikers say they are seeking pandemic pay for frontline workers and an additional $5 an hour for employees taking care of COVID patients. Cook County health officials say they are disappointed the union would strike during a pandemic and that it has used funds from the CARES Act to provide pandemic pay to employees working directly with the coronavirus. A former NBA player may be the next owner of Ebony Media. That's a historic company with deep roots here in Chicago. Ulysses Jr. Bridgman placed a $14 million bid in U.S. bankruptcy court in Houston, according to the Chicago Tribune and Crane Chicago Business. Bridgman played for the Milwaukee Bucks in the 70s and 80s. Chicago-based Johnson Publishing Company launched the Black monthly lifestyle magazine back in 1945. Right here, you're looking at archival footage of the company right now. In July, it filed for Chapter 7 bankruptcy, which was converted to a voluntary Chapter 11 reorganization in September. Earlier in the program, we talked about the Russian hack on a number of federal agencies, and joining us once again are Representatives Brad Schneider, Jan Schakowsky, and Rodney Davis. Thank you for being back. Let's talk a little bit about the aftermath of the election here. Congressman Schneider, President Trump is having these reported meetings with some fringe players here, throwing out ideas like martial law, seizing voting machines. Where do you think all of this is headed?
I think it's headed to the Electoral College votes being certified on January 6th and Joe Biden being sworn in as president on January 20th. But in the meantime, we should all be very concerned. These conversations that are supposedly coming out of the White House, talks of calling in the military and other efforts to refuse to have a peaceful transfer of power, is a threat to our democracy. The key to our democracy is the idea that we speak as a nation, the voters cast their ballots, and win or lose, we respect the will of the people. And for 240 plus years, it has been the way of our country, and now we are sitting with a president who is refusing to acknowledge that.
On that note, Vice President Mike Pence spoke today and is telling the party faithful that they are continuing to fight the election results. Take a look.
And as our election contest continues, I'll make you a promise. We're going to keep fighting until every legal vote is counted.
Congressman Davis, as your colleague mentioned, the only thing left here is Congress certifying the Electoral College vote. One of your colleagues in the House has said he's going to try and challenge that. He'd need someone in the Senate to do that. Would you support an effort in Congress to challenge the Electoral College vote?
Well, I think if you look back to 2017, we had these same discussions from some of our colleagues who did come to the floor to try and challenge that vote. It happens. But in the end, the Electoral College is, those electors are the ones who choose our president based upon the votes cast in every single state in the nation. Joe Biden is the president-elect. Kamala Harris is the vice president-elect. I fully anticipate, as one who will be participating in that Electoral College process on the House floor, to have those electoral votes counted. It may take a little longer than some other times that we've done this in the past, but I fully expect it to go off with as minimal problems as can be expected.
Congresswoman Schakowsky, what do you think happens on January 6th? Like we said, the effort would need a senator it would need a U.S. senator to support having debate and then an ultimate vote on it. How do you think that's going to play out?
Well, I certainly think that it would be a real shame for the United States of America if we didn't just see the smooth transition, including on the 6th of January. But I want to tell you what's really embarrassing to me and worrisome to me is that a majority of the members, Republican members of the House of Representatives, actually endorse some of these crackpot ideas that actually this election has not been decided. And the fact that we see so many individuals, not just those who believe in weird conspiracy theories, endorsing that idea is something that says we need to safeguard our democracy more than ever right now. But at the end of the day, we're going to see the inauguration of Joe Biden and Kamala Harris, and I believe that at the end it will be a transition, smooth or not, it's going to happen.
So bipartisan consensus here among this panel of a smooth transition. Let's move back over to COVID. Congressman Schneider, have you received your vaccination yet? And what do you know about the discrepancy here between how many doses of the Pfizer vaccine Illinois is going to get and how many they say they were promised?
No, I'll get my vaccine when we start the 117th Congress. When I go back to Washington. But as far as Illinois, I believe the vaccine numbers are starting to pick up, but I was disappointed. I'm frustrated that the administration from the beginning of this pandemic has failed to address our challenges in supply chain, whether it was PPE in the spring, and now we're dealing with the supply and distribution of the vaccines. We're 10 months into this. There should be no surprises at this point. This is a major challenge. but the first steps of getting the vaccine from the manufacturer to the distribution centers and ultimately to the places where they will be put into people's arms and get us on to the road to recovery, this is a fairly straightforward problem that should be addressed immediately.
Congressman Davis, I'll pose that question to you. Have you received your vaccination? And what do you know about the amount of vaccines coming to Illinois, not just with Pfizer, but with the recently approved Moderna?
Well, I have not gotten a vaccine. I had COVID back in August, and
that's right. That's right. You did.
Yeah, I have antibodies, so I'm going to wait until others who have not had the disease or are in a more high-risk category can get the vaccine first. But I will get it, and I certainly hope that no one is hedging and deciding against getting the vaccine because it was well-tested, well-researched, and the administration and all those who work in it need to be commended for getting it out quickly. And I'm concerned that we didn't get as many vaccines sent to Illinois as was promised. But unlike Governor Pritzker, General Perna, he stood up and he said, I'm sorry, I'm responsible. I certainly hope instead of complaining about the administration, the Pritzker administration can begin to fix the problems that we're seeing at the Illinois Department of Employment Security. I was recently a victim of somebody applying for unemployment benefits in my name. And instead of getting results, we get excuses out of this administration. And that's a big problem we have.
Congressman,
we give hundreds of millions to the state, and they need to administer the programs correctly with the money we've given them.
We have something in common because I was also recently a victim of someone fraudulently trying to claim unemployment in my name. Congresswoman SCHAKOWSKY, another concern is this new strain of COVID-19 seen in the UK. Should the U.S. think about shutting down travel from the UK?
Well, we have to understand the depth of the problem there if it's isolated into a particular area. But, you know, if we don't resolve the problem and have vaccines distributed around the world, none of us will be safe.
And Congresswoman, I'm sorry, we have to leave it there. We are out of time. Once again, our thanks to Representatives Schneider, SCHAKOWSKY, and Davis. Thanks so much for joining us.
Thank you.
Nursing homes have been hit especially hard during the pandemic. More than 409,000 residents have contracted the virus as of early December. That's according to the Centers for Medicare and Medicaid Service. And slightly trailing behind that, a little more than 350,000 staff members have also gotten infected. During all of this, one Chicago-based foundation is trying to change the way these facilities are ranked, they say, to put the focus on the care of residents. And joining us now is Dr. DEBRA WEESE-MAYER, president of the Chicago-based Mayer-Rothschild Foundation. Dr. WEESE-MAYER, thank you so much for being here.
Thank you.
All right, so your foundation bills itself as the only one devoted to person-centered long-term care facilities. Please explain to us what that means.
Absolutely. So the founding president was my late husband, Dr. Robert Mayer, and his focus was on improving quality of life for elders in addition to safety for elders. And the concept of patient-centered care is not new. It's been around for 30 years or so, but bringing it into the nursing homes that are competing for dollars, all kinds of bureaucratic regulations, and probably more than oftentimes, the resident and the families who are served are not the primary people who are communicated with. And so Rob's idea was to design a designation of excellence project so that nursing homes would rise to the level of excellence and focus on the patient themselves, or rather than calling people patients, actually residents. And also the public would become knowledgeable about a standard that could be applied to nursing homes instead of all of the more traditional, how many T's were crossed and I's were dotted, but actually the quality of the experience.
So are there ranking systems here to sort of designate how these nursing homes perform? So what's the difference between this and a more medical-centered, medical-focused care that we see in nursing homes now?
So medical care is certainly an important part of the whole concept of the designation of excellence project, but it's more than that. So the medically focused assessments don't, I won't say that they don't care, but they certainly, if it's necessary to run the nursing home and maintain health, someone might be awakened at 3 a.m. to take a shower, or they don't get to prepare their own meals, or they don't get to choose things that they would have done in their own home, and they can all be safely done, but it's just a different way of looking at things.
So again, more quality of life focus here for residents of these facilities. And your foundation awarded a university and a facility in Maine to begin research on this kind of care. Explain that for us.
Yes. So earlier this year, we submitted a request for applications and had an enormous response. And of the many high quality applications, University of Maine and the Cedars Nursing Home came in as a dyad. That was part of the study design to address year one of a 4-year and each year a different competition to, in this case, they're designing the instrument. So it's, if we say more of a discovery phase, so that they're designing what are the components of how one would determine excellence in a nursing home. And their particular plan incorporates participants, not just from healthcare, not just from regulatory agencies, but the people who are living there themselves and their families. And they will define what excellence means. And certainly in this pandemic, excellence takes on new meaning. It's not strictly about health, and it's about safety, but again, as you mentioned, quality of life. So
residents and their families will have a say here in ranking these facilities. We mentioned the staggeringly high toll of cases and deaths in nursing homes. From your research, is there any connection between quality of life and nursing homes that do better on that and the nursing homes that have struggled containing COVID?
That's a phenomenal question. I think that the study that the two main institutions are doing will likely be able to answer that question, because part of the design is that all of the data will be digital. It'll all go into a REDCap format, so it can be mined. And questions that are important, that are timely, can be answered. So stay tuned. It's a one-year grant, and I would expect over the course of this year that question will be able to be answered.
And on the issue of COVID in nursing homes, you know that long-term care facilities will be the next sort of class of folks to get the vaccine. How do you think that's going to work?
I think it'll be exceedingly well received. I think it's, obviously we all think it's long overdue. And the hope will be that that will be the end of so many people who are so vulnerable succumbing to something that in some ways could have been prevented.
All right, Dr. Deborah WEESE-MAYER, thanks for joining us and best of luck on your foundation and your research.
Thank you very much.
And up next, a virtual recital brings music lovers some joy during a difficult holiday season. But first, we take a look at the weather. This year hasn't brought much joy to live music lovers, but the Chicago Symphony Orchestra is offering a last-minute gift before 2020 is over. A concert with renowned pianist Jorge Federico Osorio, filmed at Orchestra Hall, that you can enjoy in the comforts of your own home. Let's take a listen. And joining us to talk about the concert is Chicago pianist Jorge Federico Osorio. Welcome back to Chicago tonight.
Thank you. I'm delighted to be here with you all.
All right. Well, it's so wonderful to hear music and hear you play in that space once again. Tell us what music you feature in this recital.
Well, when the CSO invited me to tape this recital, I thought carefully about the program. So I put together I think a very varied and very contrasting program with several composers. And also in the back of my mind, I I was thinking about very personal experiences that I've had with some of this repertoire that I have performed already in Symphony Center. So for me, it's a very personal thing. I love playing in Chicago. I love the Chicago public. So it was, in my mind, I was just imagining that I was playing for a full house. So in these difficult times.
So these are pieces that you have personal experience with at Symphony Center. What is it like to play in front of a big empty auditorium when, as you say, you love playing for those Chicago audiences?
Well, I think that because of the situation of COVID and everything that we are all going through, it's not that one is not used to play in an empty concert hall, or sometimes you make recordings at an empty concert hall. But the fact that all this is behind, all this is in our minds, it took a lot of concentrating, but I mean, I love performing in this hall, and I just miss the applause in between pieces sometimes. But
well, so this is a very, very specific musical question. Are the acoustics different when you don't have the bodies to absorb all the sound?
Yes, it all changes all the time, and but I think it's as I said, I've performed in this hall with a full house, and I always enjoyed very much the acoustics. The sound gets so focused on the stage where I'm performing, and that's why I always enjoy playing there.
You know, and we know that so many musicians of all styles and performance venues are struggling right now. Do you see this model, streaming concerts, as something that the CSO and you might continue even after the pandemic?
Well, I think we have to be thankful to the technology that we can all communicate so easily, and we have all this available. But whilst playing and just imagining, I keep imagining that the day will come soon when we can embrace going to a regular concert and everything is normal, and just enjoy the festive mood of a live concert. I don't think anything can replace that.
Certainly not, and so many people feel the way you do. You know, you're featuring some pieces, as I understand, from your latest album, which focuses on the French composers Debussy, Rameau, Fauré. Why did you want to focus on specifically French composers in your latest work?
The latest work, well, I've had always, since I started recording for CD records, like they have like a theme, all my recitals, like the Spanish recital, Mexican music, the Salón Mexicano, the Russian recital. So it just made sense. And also I've been sort of in love always with the French repertoire. So it just came spontaneously, this idea. And then it was just a matter of putting together the repertoire.
You mentioned how much you miss being back, experiencing and playing live music. What has your life been like in COVID over the last 10 months?
Well, because of COVID, I think it has made me think about things, reflect as to what is suddenly what we're missing. And the special thing, I think, is to keep it creative. I love my work. I mean, it has given me time to learn a new repertoire and just cope day by day with new things, I think, but keeping creative and optimistic that soon we'll all forget about this.
Light at the end of the tunnel. All right, you can find out how to view Jorge Federico Osorio's recital on our website. And now, Jorge, thank you so much for joining us.
My pleasure.
And that is our show for this Tuesday night. Don't forget to stay connected with us by signing up for our daily briefing. And you can get Chicago Tonight streamed on Facebook, YouTube, and our website, WTTW.com/news. You can also get the show via podcast and the PBS video app. And please join us tomorrow night live at 7. Should jail staff and detainees be among the first to get the COVID vaccine? And how the South Shore neighborhood is doing 6 months after widespread civil unrest. And now we leave you tonight with more from pianist Jorge Federico Osorio's virtual performance. Now for all of us here at Chicago Tonight, I'm Para Schutz. Thank you so much for watching. Stay healthy and safe, and we will see you tomorrow.
Closed captioning for this program is made possible by Robert A. Clifford and Clifford Law Offices, pleased to give back to the community through numerous charitable initiatives.